Coming up on Primary Care, we go deeper into the Flint Water Crisis in part 2 of my conversation with outspoken pediatrician Dr. Lawrence Reynolds.
Well, let me be perfectly frank. If we can build a city around an air base in Afghanistan in a matter of months, why can't we address this problem?
Hello, and welcome to Primary Care. I'm Dr. Lonnie Joe. Today I continue my revealing and in-depth conversation with Dr. Lawrence Reynolds on the disastrous Flint water crisis and how the city and its residents are coping and fighting back. Dr. Reynolds, for our viewing audience, tell us how lead is actually detected in the body.
The quickest test is blood. But remember, a blood lead level only reflects what's happened in the last 35 to 60 days. Most of the lead is in bone, but right now we use blood for screening. So even though a child has been exposed and subsequently the blood lead level is lower, that does not mean that there has been no damage from that exposure.
So the history is important.
The history is essential. And that's why it's important that we have a toxic exposure registry so that people are identified and can be followed as they age, so that if problems arise and if the technology improves to assess bone lead levels, we can come up with treatments that may help us prevent some of the problems in the future.
Tell us about other types of substances that were contained in the Flint water. Lead's the whipping boy, but tell us about other things that were exposed also.
Now I'm speaking not as a water professional, but one who's talked to water professionals. Water processing is complex. So sometimes if you treat one problem, you create another problem. One of which was the addition of excess chlorine in river water that had more organic matter than Detroit-sourced water. So this organic matter, like trees, waste, whatever leaked into our system with a 40% leakage rate, these things combined with the chlorine and made a group of chemical compounds called THCs. It's just a halogenated compound byproduct of this disinfection process. Originally, we were told if you drink it, it would be a problem. But actually, exposure to the skin in washing dishes, bathing, and showering is a problem. And the challenge is when we say there is a problem, they say, show us the proof. And what I say to that is, absence of proof of harm does not mean that there is no harm being done.
Or that the proof may have only can be expressed over time.
That's correct.
Stretch it out over a calendar. If I can only obtain the proof 30 years from now on a disease state, that does not mean that there was not harm 30 years prior to me discovering the proof. And lead is probably a perfect example of that.
That's right. As we improve the technology to measure lead in blood, as we improve the technology to assess the body burden of lead, we will have more answers. And that technology allows us to see what even low-level lead exposure does. Because right now, what we're saying is being dismissed because it's not that toxic exposure level that we would see in the old days when we first started practicing.
Tell us about Legionella. We know a lot about Legionella, but that was a shock. That was a surprise here as one of the elements involved.
Well, Legionella is a germ that's found throughout the environment, and it creates a problem when it gets into water systems and cooling towers of large buildings. Since the switch from Flint River water, from Detroit-sourced water to Flint River water, we have had a 2-year outbreak of Legionella. And the disease legionellosis, they call it. Legionnaire's disease. So now keep in mind, New York City had an outbreak at the same time. It was announced throughout the city. It was announced in national media. But here in Michigan and in Flint, we had to keep pushing for full disclosure. So there were so many deaths from, it is the largest known outbreak. So there have been actually 12 deaths, and we're still trying to get to the bottom of it. There are questions, was the alteration in water chemistry that may have caused an increase in iron, that may have provided nutrients for germs to grow when the water got into a larger building? Did all these things lead back to the inappropriate switch to river water, the improper processing of river water, the problems in the distribution system that were just allowed to go without any criticism was rejected? Even when we brought in experts like Dr. Mark Edwards and the Virginia Tech team, our local experts, Dr. Laura Sullivan, who's a metallurgist and mechanical engineer at Kettering University, or even the expert from Pittsburgh who helped address some of these things for one of the hospitals here in the city. But there's been this continual denial. The Attorney General acts as if there was a cover-up, and so he has actually taken some legal action to follow this up. So our listeners should understand this is not some paranoid delusion of a population. These are things that have basis in fact.
It always amazes me how when individuals are presented with the facts, their mind is already made up and they won't let the facts confuse them going forward. Tell us a little bit about what the community at large is doing outside of the elected officials and the medical community. Tell us about what the churches are doing, what the neighborhood block clubs are doing. How are they involved in this?
That's been the most exciting development here. I should say, for the first 3 months between October 1st, when we said there's a water emergency, and it was finally acknowledged in January by the state and the federal county, state and federal government, the nonprofit sector stepped forward and they worked with the faith community. So the Food Bank of Eastern Michigan distributed bottled water and filters. The United Way, the American Red Cross, working with our churches, set up distribution centers. Now, initially, the National Guard did it because it had to be started right away. But now we have 9 centers, and then we have smaller distribution centers that are located at churches throughout the community that distribute water, filters, and cartridges. And then the Plumbers Union stepped up and said, well, we'll make sure people are installing these things correctly. Our undocumented population stepped up and said, hey, wait a minute, we need some help here. So we have improved communication with our Spanish-speaking population, and we have an Arabic-speaking population. Flint has one of the largest deaf communities in the state of Michigan. So we have learned that we have to be more attentive to all the populations that are part of our community. And so it's just to see that level of organization. And I think our history of being a union town and being organized actually had something to do with that. Because not only were folks in the union, in the plant, or in the shop, but they go to church. They were part of the leadership. Mm-hmm. The University of Michigan Flint responded with distribution. So it's been an ongoing effort because we understand that when all these agencies leave town, we have to have a structure that we can maintain to help our children and our families.
Yeah, we don't just want them to leave and the problem remains the same and has not been addressed. Is it safe to drink the water in Flint, Michigan?
Definitely not. Water should always be filtered. If you go into our schools, you will see piles of bottled water. For certain populations, our medical society has advised if you are pregnant, if your children are under 5, if you have any renal problems or any immune problems, you should stick to bottled water just to exercise the maximum level of caution. Because our water system is so unstable, we don't know when equipment is not functioning, where water has pooled in a system for days instead of 2 to 3 days as is normal. So we have recommended this level of caution for people in those groups specifically.
You see, this is where I have a problem, okay? You know, you get the media that comes to Flint, and this kind of stuff does not, how come this kind of stuff did not rise to the level of the Rachel Maddow show with these kind of statements being made, okay? This sanitation that we do is just killing us. I shouldn't have said that like that, should I, on camera? Okay? That's okay, use it if you want to, but it is killing us. It is at the hands of people who have a different agenda. The agenda includes the cover up, the blame you, not me, the cost of doing things and keep the outlay of dollars to a minimum. That milieu is a prescription for failure.
Oh yes, public health issues are local. Okay, in the response, you have to respond to local conditions. You can't take a plan off the shelf and implement it. And perhaps one of the most frustrating things was every time the level of disaster escalated from county to state to federal and other agencies came in, we would have to brief the new arrivals, we would have to debrief the folks who are departing. So it was a continual process, and the local health community had to insist with the citizens that there are specific issues here that must be addressed, and it can't be a playbook that you just pulled off the shelf.
We'll be right back with more primary care and Dr. Lawrence Reynolds.
We have a public health crisis in Flint. 10,000 kids have been exposed to high levels of lead.
These kids did nothing wrong, and we are going to flip the story and give hope to our children.
This is about coming together as a community. We're in it until people can take a drink from the tap and not worry about what the water quality is. We have to make sure that this never happens again. And I think removing the risk, which are the lead pipes, would go a long way to helping that.
There's no antidote for lead. So we are building this model public health program. Donating to Flint Kids will help us support access to nutrition, universal preschool, access to a pediatrician. These are the things that our kids need now.
To have two strong universities that are willing to fight for our community is amazing.
This is not a throwaway city. These are not throwaway kids. And if there was ever a time to invest in our children, it is these children, and it is now.
Did you know that the CDC recommends vaccines for preteens, even beyond the ones required by many schools? Or that not staying up to date with recommended vaccines may put your child's health at risk? Or that vaccines are studied for many years before they're made available to the public? There's a lot to know when it comes to vaccines. Get the facts by visiting vaccinesandyou.com and talk to your doctor about which vaccines may be right for your family. When it comes to helping to keep your family healthy, it pays to get the facts.
Dr. Reynolds, you're a resident here in Flint, Michigan for over 25 years now. How has this affected this lead poisoning water crisis? How has this affected you and your individual family?
First of all,
your pets.
Yes. First of all, I should say I should learn to listen to my wife, because she would not shower, she would not bathe when she noticed the water was dark brown to yellow, and I should have paid more attention to what she said, because, you know, I'd turn the water on and it would go from brown to clear, and you know how we say, oh, well, that's normal. And then it comes down to when we finally discovered that we were being poisoned. Learning how to cook with water, you go to the spigot, you turn it on, you wash your food. No, you can't do that anymore. You have to use filtered water, or you have to use bottled water. You go to prepare your coffee in the morning. You go to fill the coffee pot, you say, wait a minute. You've got to go get the bottled water or use filtered water. So it's always, you're being conscious of how you're using the water, how long you're going to use the water if you're bathing or showering, what the temperature is. Can I trust the latest announcement? So it can be very draining. And then I've had to replace, and this has nothing to do with human life, I've had to replace a water heater, a dishwasher, because the water was so corrosive. But understand, I can walk, I can lift water. seniors, not all seniors or moms can do that. Okay, I have transportation to pick up water. Not every family can do that. And then you're a parent. How many times have you seen your child go into the bathroom and drink from the sink faucet just because it's there?
Because it's there, yes.
Right. So how can a parent be so vigilant that they can't watch, that they can watch their child and prevent that? And then what I tell people half jokingly is when you go over your in-laws' house and they're not using the filter properly or they're not changing the filter. So you almost have to say, look, baby, travel with your water until you're at a house where you can trust the judgment and the maintenance that's going on for water filtration.
How far are we away from being able to say that the Flint water is safe to drink?
If it happens in the next 3 to 5 years with a concerted effort, that will be miraculous.
That means a financial commitment on all levels, local, state, federal.
Exactly. With a rebuilding of our water distribution system, determining if we have the capacity to treat and process water in a safe fashion and the ability to sustain that process. If I may rant, you know, the big words here now are we need small government. So shrinking the profile of government. And as a senior person of color whose relatives have come from the South as well as other places, we know all about small government. You have no indoor plumbing. You have no sewage system. You have no library. You're using hand-me-down books. You're in schools that are falling, the buildings are falling apart and unsafe. And to that point of schools, how many communities know that schools are not required to monitor and check water quality for lead? And so-called lead-free fixtures are actually 6 to 8% lead. So the first child who drinks from that fountain that day or after a break or a weekend gets a bolus of lead. So all these things are being uncovered. The lack of will to address lead, as you have said earlier, the only way to handle this is primary prevention. Eliminate lead from the built environment. We did it for leaded gasoline and we lost our way after that. But it must be done. If we can send a man to the moon, if we can send a probe to land on the planet of Mars, why can't we do this?
If there was an immediate effect of lead, our community, our government, the politics would respond totally differently. But without having that immediate effect present, someone needs to bring that immediate response to the situation.
Precisely.
Is that happening well enough in this Flint crisis? You know, we read the papers, we see what's on local media and national media, but you live here. Mm-hmm. You're in this up to your elbows. Well, yes. No, your total body is in this if you're showering in the water. But here again, what is your perception of how well this is coming along? You said 3 to 5 years. Is that too slow? I mean, is it on track? I mean, what's the reasonable expectation? We're not asking for touch and heal here, okay? We're looking at what should really be done and a reasonable time factor to achieve the desired outcome.
Well, let me be perfectly frank. If we can build a city around an air base in Afghanistan in a matter of months, why can't we address this problem? We have the Army Corps of Engineers, and their charge may be for bodies of water, moving bodies of water, but why can't that charge be changed? They have the capacity to do these things. So where is the will? And then we talk about this is a man-made disaster as opposed to Hurricane Katrina. To me, as a resident of Flint, that's a distinction without a difference. It is a disaster, which requires a disaster response. Just because the damage is underground or in your internal plumbing and it can't be seen, it is still a disaster. And perhaps the fact that it was avoidable, preventable, man-made, due to lack of diligence, it has to be addressed.
By the way, my relatives in the 9th Ward in New Orleans still can't go back. I mean, the only thing that's not there is the water. It looks the same. Good. We're going to go to a break. We'll be right back with more primary care.
We have a public health crisis in Flint. 10,000 kids have been exposed to high levels of lead.
These kids did nothing wrong, and we are going to flip the story and give hope to our children.
This is about coming together as a community. We're in it until people can take a drink from the tap and not worry about what the water quality is. We have to make sure that this never happens again. And I think removing the risk, which are the lead pipes, would go a long way to helping that.
There's no antidote for lead. So we are building this model public health program. Donating to Flint kids will help us support access to nutrition, universal preschool, access to a pediatrician. These are the things that our kids need now.
To have two strong universities that are willing to fight for our community is amazing.
This is not a throwaway city. These are not throwaway kids. And if there was ever a time to invest in our children, it is these children, and it is now.
Welcome back. We're here with Dr. Lawrence Reynolds, who's the pediatrician and president of the Mott Children's Health Center here in Flint, Michigan. Dr. Reynolds, a lot of people have talked about the money that is coming to Flint, including from Washington and Lansing and donations from around the country. Where's the money going?
Well, let me talk about what I know about first of all. We have the Flint Healthy Kids Fund, sometimes called Dr. Mona's Fund, that's administered by the Community Foundation. I am chair of that, and we've received in excess of $7 million in donations. Now, our challenge is, how do we handle the problems of lead exposure over a 15 to 20 year course? How do we increase community capacity to deal with this issue? And how do we address immediate issues? So we've been working with the United Way. They address the more immediate issues like water and filter distribution. How do we work with our educational system, our libraries? You have to understand that 2 out of 3 children in the city of Flint attend charter schools or go to schools outside the district. So those schools will also need services. So that's what the Community Foundation is doing with the Flint Healthy Kids Fund. Now we get into the figures of 170 million and 20 million. First, we have to understand that money comes to the state and is administered by the state. Some of those funds are loans. Some of those funds are actual grants, but it's administered by the state. We talk about 170 million on the federal level. The state, that money comes to the state and will be administered by the state. So the questions will be, how much will Flint get? How much will be a loan? How much will be applied to loan forgiveness that's been generated over the past years, especially under the emergency manager system? So I can't answer that question. That would be an excellent question to ask our governor. Now, we have received funds for early childhood education. We have received funds for fresh fruit and vegetables. We have received funds. We've actually become a health personnel shortage area so that primary care physicians and mental health specialists can come to the city of Flint and help address these issues over the long term. But when you look at those tens of millions or hundreds of millions of dollars, there are so many questions and conditions that have to be answered and clarified. And I'm hoping one day that our elected representatives, and I don't care from which side of the aisle, will be able to address those things.
You know, we know people in the Flint area. There happened to be a picture that was floated around of 2 pets who had died from drinking Flint water. Their owner was a physician, and he said it had ramifications with him, his children, how pets become part of the family. This is probably does not rise to the level, as they say, of what the toxicity exists like and looks like in human beings. But when we look at the far-reaching effects of something like poisoning of any type, it has to affect something like nature. Okay?
Oh, yes.
Pets, the land, farming.
Yes.
All of this crisis has far-reaching effects around what we see as Flint, but it spreads out from Flint simply because of the natural progression of these kinds of things that go along. And one of them is how this crisis affects other than human beings.
Yes. Well, these are quality of life issues, because our ability to grow a garden or have a pet, when that's questioned or disrupted, it disrupts the quality of life and it increases stress, which has health effects on all of us. So although I'm charged with taking care of children and people, I have a pet in my house, and we have a responsibility. Once we take these animals, it's our responsibility to care for them. And you know, many of the folks here are from up north in Michigan or down south, and they know this. And having pets and being able to farm without worrying about contaminated soil, or garden without fear of contaminated soil, those are significant quality of life issues that you take for granted until it's been taken from you.
Dr. Reynolds, this has been probably the most stimulating program of all that we've done, because it's so close to home. Thank you again for joining us on Primary Care. It's been our pleasure.
Thank you, Dr. Joe.
I'm Dr. Lonnie Joe, and thank you for joining us on Primary Care. We'll see you next time. You can get more information about the show and our guests at primarycare-tv.com and continue the conversation on Facebook and Twitter.